Good morning, everyone. And today, our topic of discussion is again, we are still in hematology, and today we are going to start with polycythemia. Um, to tell you, like, if you have not listened to the previous lecture, so you must go in a sequence. First of all, study, like, see the introduction, then see hematology CBC, and then see the hematology anemia, and then come on polycythemia. Why? Because I am going in this way, like how you are going to do interpretation of a CBC report, right? Um, Now, again, for example, um, you saw that the HB level um, or the packed cell volume, again, I will take the help of Bing and I'm going to show you CBC report, right? Um, Images, oh sorry, complete blood count, complete blood count. Okay, so I wanted to show you like the real, yeah, this one looks nice. So as you can see over here, we had discussed this one, the same report. Okay, I'm showing you, which I showed you before as well. So you had CBC results in front of you, and here you will found, for example, like the HB is more or the RBCs are more. Then we see something called as packed cell volume. Okay, so again, to tell you, to show you some other report, for example, this one is what you can say, the guideline value for complete blood count, right? These are the normal values they are showing. Or you can say um, this one, for example, again, like the same values which we have already discussed. So there is something called as packed cell volume. So packed cell volume. So we also call it as um, the short form as PCV, of course, right? Packed cell volume. And now to talk about packed cell volume, um, what happened is one of the results they gave us in CBC report is PCV or the packed cell volume. Simply they see when they are going to pack all the cells together, so how much you can say space they are going to take in that blood sample. Of course, like the blood is the blood, the serum as well as the cells, which are in the blood. So to tell you again, what I'm talking about is maybe I can get some photograph. Okay, you can see over here when they are going to see, uh, check the blood. Okay, uh, they are going to found it in this way, and what they will have is a plasma, then there is a small part of buffy coat, and then there is hematocrit. So you can see over here the normal hematocrit is like the values between the males and the females. Okay, and now this basically this is what we call it as packed cell volume. Now again this one, sorry, okay, I don't know what's wrong with my ping right now, but okay, leave it. So like this one is again the hematocrit of the packed cell volume, right? So see, like normally it is like 45% elements, but in anemia it will be less. But in polycythemia, because the RBCs are more or the cells are more, it is going to raise. Okay, so this is like a very good way of showing packed cell volume. So you can see again this one, like the packed cell volume or hematocrit. Okay, so all the cells, they measure and they found. Okay, and this one is like the red blood cell volume. So like of course removing the WBC is like what is left is this one. So polycythemia is simply defined as when the PCV or the plaque cell volume is greater than 0.51 in males or greater than 0.48 in females. Okay, so we call that the patient have polycythemia, like simply the cell mass is increased or the cell volume is increased. Okay, or the plaque cell volume is increased. So now, in order to distinguish between a true and apparent polycythemia, because simply polycythemia can be classified into the true one and the apparent one. Of course, like we must measure what you can say red cell mass. Okay, how many red blood cells are there? Why? In order to distinguish uh, distinguish between you can say true or apparent, okay, polycythemia. Now, why this thing is important? Because um, apparent polycythemia is due to reduction in the plasma volume rather than increase in the red blood cells. Simply, uh, again, not a rocket science, but to show you exactly what's going on, and how it is apparent polycythemia. You can get that thing in this way, in this one. Yes. So, if you can see over here, sorry, okay, if you can see this one, this photograph, uh, this is apparent polycythemia, and this one is true polycythemia. Simply, in true polycythemia, the like this is the normal person. Okay, uh, making it a little larger and to show you here. This is a normal person, and like in normal person, the RBCs are having this much mass, and this is the plasma. Okay, but see in what's happening in polycythemia, this mass which is normal is increased. Okay, so the hematocrit rate, because what is hematocrit? Like they're checking the percentage of RBCs with the total volume of the blood which we have. So see, uh, in this one, the RBC's mass is truly increased, and the plasma is of the same level. But if you will come over here, see the RBC mass is same like this one, but what is going on here? There is less plasma, right? The plasma is decreased. So this is called as apparent polycythemia. Simply, when the RBC mass is same, but plasma is uh, in decrease, so of course we take the percentage and we say like the plaque cell volume is increased. So that's why apparent polycythemia is simply due to reduction in plasma volume rather than increase in red blood cells. A very easy way to explain that thing. Okay, so apparent polycythemia in this one, there is reduced plasma, but the normal mass of red blood cells are there. So now, how we measure red blood cell mass? Okay, now we measure it by labeling the red cells or the RBCs with a radioactive isotope. Okay, and when we label it with the radioactive isotope, uh, like the predicted red blood cell mass can be calculated uh, based on the patient's height and weight. And true polycythemia is diagnosed. The true one is diagnosed if the red blood cell is more than 25% higher than what is the predicted one. Of course, now the polycythemia, which we are discussing, by the way, uh, or what we can say, the true polycythemia, uh, have number of causes. Okay, so first of all, we are going to discuss the causes, and then, of course, like we can talk about the rest of the test. Okay, which we can do to what you can say to distinguish between each type. So classification of polycythemia, polycythemia. So simply to classify polycythemia, Remember, there are two main causes of polycythemia. So now, what are the true causes? One is the true one, true polycythemia, and the one is the apparent one. Okay, so whenever it comes to the true polycythemia, if you know, polycythemia could be primary, it could be secondary to some other conditions. Okay, now whenever it is primary, we simply call it as um, polycythemia rubra vera. Okay, so this is the name which we give to the primary polycythemia. And whenever it is secondary, of course, it is secondary to certain conditions. So it could be secondary to hypoxia, for example, people who are living at high altitude. It could be secondary to some renal conditions. For example, there is a tumor in the kidney which is making more and more and more erythropoietin, and there is more and more production of the RBCs. Or it could be, you can say, or you can say like that could be excess erythropoietin. Okay, and like rest is that excess erythropoietin could be due to renal causes or could be due to other tumors. Wherever it is like due to hypoxia, remember there are certain conditions very well explained and guided, by the way, like in lung conditions, lung diseases. What happened, like there is less oxygen in the blood, so the body take it as a signal towards reduce oxygen level in the body, and it is going to produce more and more RBCs. Okay, or you can say cyanotic heart condition, cyanotic heart conditions. Okay, heart diseases, of course, in newborns. So of course, like in then there is more and more RBCs production. Chronic smoking can lead to polycythemia as well as the people who live in high altitude. Like they will be having hypoxia and what you can say more and more RBCs production. And whenever this is due to excess erythropoietin, it could be renal cell carcinoma, in which there is tumor in the kidney which is producing more and more erythropoietin. It could be polycystic kidney disease or adult polycystic kidney disease, in which like there is more erythropoietin production. Many times adrenal tumors produces more erythropoietin. Sometimes hepatocellular carcinoma produces as well. So these are like few of the causes which can give true polycythemia. And whenever it is due to apparent polycythemia, it is a type which is apparent polycythemia. Remember, it is not like the red blood cell mass is reduced, rather it is something in which the plasma is reduced. So dehydration could be one of the cause, as well as there is one syndrome called as Guy's-Box syndrome. But okay, for the time being, we will just take it as dehydration. And now dehydration can be catch on clinical findings, right? Clinical examination, history. Of course, the patient will be having diarrhea. The patient will be having any kind of clinical condition with which like they are losing more and more water from the body. So how we can distinguish what you can say causes of true polycythemia, because why I'm saying only true polycythemia, because if you know one cause which is causing apparent polycythemia, we can catch it on the history, right? So now in this case, guys, the most important thing, for example, if the patient have hypoxia, we can do a test called as ABGs. Okay, now what is ABGs? It is atrial blood gases. Of course, we are going to study this thing in detail. Okay, as well as like there will be a lecture on ABGs, right? So that's why I'm not mentioning over here, because the discussion will go on some other side. So of course, like for this one, wait for the next lectures, it will come along. To check for like increased erythropoietin levels, for example, the first test which we can run is to look for erythropoietin levels, right? So erythropoietin levels we can check, okay. And when the erythropoietin levels are increased, then we have to search for example, from where it is coming. Then we can go for ultrasound, for example. And now see, ultrasound is also examination which is done to detect some structural abnormality like renal cell carcinoma, like tumor in kidney, tumor in liver, tumor in adrenal glands. Okay, and so see how you are going. You did a CBC. You found that the patient have increased RBC's number, increased hemoglobin number. You check the pack cell volume. You found it is raised. Okay, and you took the history. You do the examination, and then you have to find the cause of that thing, right? So simply, you can check for ABGs if to check for hypoxia. You can take history from someone, either they are living at high altitude or not. You can check the erythropoietin levels. You can do a ultrasound, okay, to catch uh, if there is any tumor. And of course, like whatever is found, we are going to what you can say do more and more and more testings, of course, to diagnose the condition, right? So this is what you can say can be done uh, for this thing. Okay, guys, in this one, which I did not talk about before, like basically, I think I was off the track when I was discussing anemias and especially iron deficiency anemia. Sorry, microcytic anemia. Uh, One thing, uh, as I told you, uh, um, when microcytic anemia is the most common type of anemia, then whenever someone is coming with microcytic anemia, I told you that think about iron deficiency anemia, which is the most important cause. And I told you like then our next suggestion will be of doing iron studies. And I told you when the iron studies will come back normal, then your second suspicious should be um, simply to think about thalassemia, right? Now, thalassemia is such a condition like it can run in families even. Okay, so by the way, um, to talk about thalassemia, whenever we are okay, we categorize thalassemia in which what you can say it is abnormal hemoglobin, right? Or so simply we can say thalassemias are what it is hemoglobinopathies. Okay, like of course, like there is some pathology in the hemoglobin. The hemoglobin structure is not normal, right? So now, if you know what is hemoglobin is made up of, hemoglobin is made up of iron with globin. And what is globin? It is a protein part. And as you know, uh, like our hemoglobin, which is circulating, which is the gas carrying, what you can say, uh, the gas transporting protein in the blood, of course, like okay, so and it is like the iron containing part as well as the protein part. So this protein part, what I wanted to talk about is uh, basically made up of different type of proteins, right? And what is the thing here? We say that there is types of hemoglobin. For example, there is um, hemoglobin F, or you can say the fetal hemoglobin. So the fetal hemoglobin, like this is made up of two alpha chains and two gamma chains, and then there is um, hemoglobin A, which is also called as uh, adult hemoglobin. Okay, that's why they make it as A, and it is made up of two alpha as well as two beta chains. Okay, and basically when we are born, our blood have more than 95% of hemoglobin A, and then there are many type of hemoglobins. For example, hemoglobin uh, A2 is also there. Hemoglobin, uh, what you can say, hemoglobin BARS is also there, which is not compatible with life. The people die. Or hemoglobin S, for example, is there, which is present in the sickle cell disease, right? And uh, there are many types of hemoglobin. There is hemoglobin C. There is hemoglobin E. Okay, so different type of hemoglobins are there. So remember, like for example, hemoglobin S, of course, like there is just one of the amino acids, like it is substituted with the other one, and the person have a sickle shaped RBCs, right? So remember, whenever there is whenever there is thalassemias, okay. So what happens? Thalassemias are simply like this one, the adult one, for example. It have two alpha chains and two beta chains, right? So uh, now, whenever there is thalassemia, what happens? Either it is called as alpha thalassemia or beta thalassemia. And as the name shows, whenever it is alpha thalassemia, it means there is problem with alpha chain. Whenever it is beta thalassemia, remember it is uh, problem with beta chain, right? So, uh, what is thalassemia? Thalassemia is a type of hemoglobinopathies. What it means, like the hemoglobin is abnormal, or there is pathology in the hemoglobin, or the globin part. And in this one, the globin part, which is the protein part, it is made up of two alpha chains and two beta chains. When the alpha chain is abnormal, alpha hemoglobin, alpha thalassemia. When the beta chain is abnormal, it is beta thalassemia. And again, there are subtypes, but again, like our discussion is not right now. What you can say, thalassemias. But what I want to tell you now, uh, it depends on, for example, how many alleles are there. For example, if we will talk about the alpha chain, okay, there are four alleles for alpha chain. So, of course, like two alleles the person take from the father, and two alleles the person take from the mother, and there could be abnormality in any of the allele. So, if alpha thalassemia is four alleles so different, like that, definitely there are four type of alpha thalassemias, and beta thalassemia have two alleles. So uh, of course, like there could be combination of any of these things. Okay, so to talk about alpha, for example, alpha thalassemia, I will tell you now. Okay, to talk about alpha thalassemia, for example, there are four alleles. So the normal makeup of alpha chain is like this. Like there is alpha, alpha, oblique, alpha, alpha. So see, like all the alpha chains are present, right? So this is what is in the normal people. Okay, and for example, there could be, if one allele is missing, so uh, there could be alpha, and this allele is missing, and then there is the other alleles are normal as well. So alpha alpha. So this is like one type of thalassemia, right? In which one of the allele is missing. So now this is also called as um, alpha thalassemia. Sorry, thalassemia silent. Okay, why? Because these people, they are normal, completely normal, right? They don't have much problem. One more combination could be, you can say, absent of allele, alpha chain is there, and then in the other one, there, like one of the allele is absent, and then there is normal alpha chain. So uh, so see, two alleles are missing, right? When two alpha chains are missing, uh, still, like, they can produce, like, you can say, near normal RBCs, okay? But how they present with, uh, sorry, the spelling, sorry for the spelling mistake. Uh, they present with mild type of microcytic anemia, okay? So, of course, like, this is one of the presentation of thalassemia, okay? So they present with microcytic anemia, okay? So now, for example, there could be three basically, like dash dash missing missing, and then one chain is there alpha, and fourth one is also missing. Now this type of hemoglobin, we call it as hemoglobin H, okay? Or we can say it is hemoglobin H disease, the other name, okay? Why? Because these are the people, their hemoglobin is very much unstable, okay, and they have a very severe type of condition, right? So, and like one of the condition could be, uh, you can say, absent absent oblique absent absent. And what is this condition, guys? Simply, I told you, this is incompatible with the life. Okay, these patients, they are completely incompatible with the life. They cannot survive because they are uh, like their hemoglobin is completely abnormal. So they are unlikely to survive. So as soon as they are born, they are born dead. Okay, so of course you are not going to find any patient like this because they are born dead. So again, I'm just explaining you the structure of hemoglobin over here, right? And I'm telling you what is hemoglobinopathies. And remember, thalassemias are an example of hemoglobinopathies. Okay, so why I'm stressing on this thing too much is simply because when I was discussing, for example, iron deficiency anemia, I mentioned you this thing that if there is microcytic anemia, the first thing we go for is to check for iron studies. And I told you when the iron studies come back as normal, think about thalassemia. So what to do if the iron studies come back as normal? We go for a test called as electrophoresis. Okay. Now, electrophoresis is a very interesting type of test. Okay. Now, uh, what is electrophoresis? Uh, or you can also call it as hemoglobin electrophoresis, right? But simply remember, electrophoresis, they have what you can say the same um, way to do that. I will take the help from Bing again just to show you some photographs, and I will write electrophoresis, okay, and images, okay. Okay, see this one. A very important thing to show you over here is this one. Okay, now what you can say. I don't know what's wrong with this today. See, uh, there is a machine in which like they put some uh, mixture, okay, and there is a cathode and there is an anode, and you know like the proteins are negatively charged, and many of the things in the blood, they are positive charge or negative charge. So what happens, like whenever we put like this and we pass the current, so the negative charge things, they will go here and the positive charge things will stay here. And the other thing is, of course, like if the particle is heavy, big size, it is going to travel less distance because of size. But if the particle is very much small, it is going to travel a long distance, right? So this is the basics of electrophoresis. Now, like to tell you more about electrophoresis, um, you can see, for example, this one. Okay, again, like they are showing you like a gel tank is here, and they are going to pass the current, okay, with anode and cathode. Okay, so when we pass the current, and okay, you can see over here, um, for example, this one. When we are going to pass the current, there is electrode, the negative and positive one, there is solution, gel is there, and we put the DNA samples, so the DNAs, they move, or the particles, they move, and we get a result like this way. There is longer bands and there is shorter bands, right? To tell you more about, to explain you more about this test, what you can say, we get a result like this. Finally, what we will get is a result like this. See, they put DNA samples. This is a negative electrode. This is the positive electrode. Sorry. So this is a negative electrode and this is a positive electrode. Okay. I don't know what's wrong. And see, the heavier fragments, they move slow, and the lightest fragments, they move fast, and these are the bands we formed, right? So uh, we do electrophoresis, okay, in order to diagnose thalassemia. So whenever like someone we are suspecting thalassemias, we request electro, or you can say in this case, because we have to check the hemoglobin electro for electrophoresis, right? So we request a hemoglobin electrophoresis. Okay, in the case like whenever we want to check like either the patient of thalassemia or not. So simply hemoglobin electrophoresis, it's a blood test. Uh, it can detect different types of hemoglobins. Okay. My brain is not working fine. Otherwise, because I think it's like wasting more time than giving us information. Hemoglobin electrophoresis. If if there is success over here, yeah, this one. Yes, this one. So now you can see over here, these are the patterns of hemoglobin electrophoresis. This is the normal. See, normally in our blood there is a lot of hemoglobin A and a small amount of hemoglobin A2. I told you 95% is like this. So see, in beta thalassemia, see, this hemoglobin is less, this one is more. In beta thalassemia major, this one is even less, this one is even more. In sickle cell trait, see, hemoglobin S is making a big band. And in sickle cell anemia, see, this band is even enlarged. So this one is used to catch different types of hemoglobinopathies, okay? Or either how much hemoglobin S is there, how much hemoglobin. So all these are electrophoresis tests, they are showing you over here. Yeah, this one is the real one. And they gave you the reading in this graphic form as well. Okay, so you can see over here in this one, like these are the bands we are seeing. Okay, so uh, now it can detect different types of hemoglobin, right? Simply, uh, it is there is a gel inside, and that gel basically helps in separating different hemoglobins, and the test can detect abnormal hemoglobin. If there is hemoglobin S is more, sickle cell disease is there. If there is uh, beta chains are more, think about beta thalassemia. If there is alpha chains are more, think about alpha thalassemia. Okay, not think about like this will be a diagnostic of uh, thalassemias. Okay, so uh, electrophoresis or hemoglobin electrophoresis, you can say, is used to diagnose different hemoglobinopathies. Okay, so this is the test we can do in the labs, and which we help in diagnosing different things. So guys, thank you so much. In the next lecture, we are going to that's all about RBCs. Uh, just the shapes are left. Uh, so in the next lecture, I'm going to show you some abnormal shapes, or I can show you together abnormal shapes of RBCs as well as WBCs, right? And then uh, we are going to start with what you can say other blood cells type like WBCs and platelets. And once we will finish that, then we will talk about other investigations like electrolytes, ABGs. Okay, or like first of all, uh, we like my target is to finish all the blood test. Then we will go move on to the urine test. Then we will move on to like imagings, and then we will move on like we will go in this way. So thank you so much, guys, for listening. Hope you understand well.